So today we are going to talk about some general concepts related with the gastrointestinal system motility, right? First of all, I will talk about the basic structure of the gastrointestinal system, which I have already discussed in detail in the video related with the histology of gastrointestinal system, right? Then I will go into detail of special features of smooth muscles of the gastrointestinal system. As you see in this diagram, that this is the wall of the GIT which I am showing, but I have enlarged, especially its upper part. And here is the lumen, and this blue lining, this is a mucosa, epithelium of the mucosa. Here is lamina propria, and here is muscularis mucosae. So these three layers, this is mucosa of the gastrointestinal system, and here I am showing submucosa, and this is muscularis externa with circular layer of muscles which is inside, and longitudinally oriented smooth muscles which are outside, and this is serosa, right? So this is the basic structure of gastrointestinal system. Now in this gastrointestinal system, what we can see that smooth muscles are present as a very thin film in the muscularis mucosae in this area. Is that right? But most of the smooth muscles in gastrointestinal wall are present in, what is this layer? Muscularis externa. And these smooth muscles are mainly in two layers. The inner layer of smooth muscles, which are circular layer of the smooth muscle, and outer layer of the smooth muscles, which is basically longitudinally oriented. Now let's go into detail of smooth muscles of gastrointestinal system. Actually, smooth muscles of gastrointestinal system, they make large bundles, right? These bundles, right? These bundles, usually one bundle has about 1,000, right, smooth muscle cells. Let's suppose that this is one bundle and it has at around 1,000 smooth muscle cells, right? And these bundles of the smooth muscles which are present in gastrointestinal system, right, these bundles are oriented longitudinally in the outer layer of muscularis externa, and same bundles are present circularly in the inner layer of muscularis externa. Now within this bundle, what really happens that these smooth muscles are interconnected with each other through gap junctions, right? What I mean by gap junctions, let's suppose I make one smooth muscle here, and suppose here are multiple smooth muscles of gastrointestinal system. Now actually, of course, these are the nuclei in the smooth muscle. Now let us suppose these few smooth muscles represent one bundle, but of course there are in one bundle there are about 1,000 smooth muscle cells. These smooth muscles are connected with each other through gap junctions. What are these? These are gap junctions, and these gap junctions are low resistance communication systems. So you can say that one smooth muscle can communicate with the neighboring smooth muscles through these specialized gap junctions. Gap junctions are specialized areas where smooth muscles come in touch with each other, and smooth muscles are having special channels or special electrical windows or channels, low resistance channels, due to which ions and small molecular weight metabolites can move from one smooth muscle to the other smooth muscle, right? And these gap junctions, one smooth muscle has multiple gap junctions which connect that smooth muscle with the multiple neighboring smooth muscles, right? Now the point which you need to understand is, because all these smooth muscles in a bundle are connected with each other through the gap junctions, right? Now any electrical activity, any significant electrical activity in one smooth muscle will be communicated to the neighboring smooth muscles also, right? So what does it mean? It means that electrical activity in one smooth, if you stimulate one smooth muscle, that stimulation will go to the all smooth muscles in the same bundles. Is that right? For example, if there's action potential, you stimulate this smooth muscle, right? Then you have stimulated one smooth muscle, but connect it will the ions, right, or depolarizing ions or repolarizing ions. Those ions will be connecting to each all these smooth muscles through these gap junctions. What does it mean? That all the smooth muscles in one bundle are behaving as a network of smooth muscles which are electrically syncytium. What is this? Electrically they are interconnected. If you stimulate any one, if I stimulate this smooth muscle, all others will be also stimulated. Is that right? Then second point, you need to understand that not only gap junctions are present in between all the smooth muscles which are in one bundle, it is also seen that actually smooth muscles in different bundles also are connected with each other. Let's suppose there is a smooth muscle here or smooth muscle here. Now this is a separate bundle, but the point which you need to understand is that not only in this bundle of smooth muscles, all smooth muscles are connected with each other through the gap junctions. Not only they are here connected with the gap junctions, but a very important point is that smooth muscle in one bundle are connected also to the smooth muscles of the other bundle through the gap junctions. Is that right? So it means if you stimulate any smooth muscle in one bundle, then adjacent bundles of the smooth muscles will be stimulated. What does it mean? If I stimulate electrically this smooth muscle, right, then what will happen? That for example, it is undergoing action potential. Then this action potential or electrical change will spread not only into all these smooth muscles in this bundle, but it will also communicate to the adjacent bundle also. So what does it mean? That smooth muscles in gastrointestinal system, they are connected with each other through gap junctions, and due to this reason, they act as electrical syncytium. Is that right? And due to this reason, these smooth muscles in gastrointestinal system, they are called unitary smooth muscles. What are they called? Unitary smooth muscles. What I mean by unitary smooth muscle, that all these smooth muscles, the millions and millions of smooth muscles which are connected through gap junctions, they act electrically as one network, an intercommunicating network electrically. Am I clear? Any question up to this? Right. Another thing, as I told you, these bundles, where every bundle has about 1000 smooth muscles, these bundles of smooth muscles are longitudinally arranged in outer muscularis externa, and same bundles are arranged circularly in the inner muscularis externa. But the point which I want to highlight, even there are few, not much, but there are few connections between the smooth muscles present in outer longitudinal layer and inner circular layer as well, right? But more gap junctions are present in between the smooth muscle in longitudinal layer, and more bundled gap junctions are present in between the smooth muscle in circular layer. But there are very few interconnections or gap junctions between the smooth muscle bundles in outer longitudinal layer and inner circular layer. Do you have any question up to this? Right? After learning this thing, then the next point which you need to learn, that what is the normal electrical activity in the gastrointestinal smooth muscle. As you know, in the heart, there is a pacemaker. In the same way, in gastrointestinal smooth muscles, some special cells which are called, there are some special cells which can electrically stimulate the smooth muscles, and these cells are called interstitial cells of Kajal. Interstitial cells of Kajal. Now these interstitial cells of Kajal, they are present especially in between the longitudinal and circular layer, right? And these special cells can produce pacemaker activity. They can produce what? electrical fluctuating electrical activity. Let's suppose if there's a cell here and this is an interstitial cell of Kajal, this can produce, suppose these are 3 cells of interstitial cells of Kajal, they can undergo, their membranes can undergo electrical fluctuations, and due to the gap junctions, these electrical fluctuations will be communicated to the neighboring smooth muscles, and then that electrical wave will pass from one smooth muscle to the next, so on and so forth through the gap junctions. Now, the question is that what is the electrical activity in one smooth muscle? Now I'm going to draw one smooth, let's suppose this smooth muscle I enlarge over here and show you what are the electrical activities which goes into a smooth muscle, right? Pacemaker activities from where? Interstitial cells of Kajal, right? They basically produce the electrical activity which spreads to the neighboring smooth muscles of gastrointestinal system through the gap junctions, and then this electrical activity, depending upon the excitability of the smooth muscle, will spread to wider areas. Now let's see what is the electrical activity in one smooth muscle, right? Now I'm going to draw one smooth muscle. Actually, if you study the electrical changes or voltage changes in the across the membrane, right, of the cell membrane of the smooth muscle, you will find that the electrical potential inside the membrane fluctuates, right? And let me show you how are those fluctuations. Those fluctuations which are normally occur, and these fluctuations are called slow waves. Now let me explain what are slow waves. Now let's suppose, now what is here, that this is suppose resting membrane potential. Now resting membrane potential in the smooth muscles of gastrointestinal system is somewhere between, yes, minus 60 millivolt, right? And here it is, suppose minus 40 millivolt, right? Now, what really happens in the smooth muscles of gastrointestinal system, there are special channels. There are two theories. One theory is that there are calcium channels and which allow the small amount of calcium to come in, right? And if small amount of calcium is trickling inside these smooth muscles, what will happen as cations are coming in, then resting membrane potential will move towards, yes, it will become less negative. What will happen? This potential which is minus 60, it will become minus 55, it will become minus 50, even it may become minus 45. So what really happens, that there are special type of channels present in the membranes of gastrointestinal smooth muscle which allow little bit sodium and calcium to come in, right? And slowly the resting membrane potential become less negative or become slightly depolarized, right? Slightly depolarized, but it will reach to the peak. Once it reaches to the peak, then what happens, that potassium channels open and potassium goes out. And when potassium is going out after the peak, as potassium channels open, right, what will happen? Potassium will start leaking out as positive ions are being lost, then progressively membrane will become more negative and reach to it resting membrane potential minus 60. But as soon as it touches there, again these sodium calcium channel allow again the sodium and calcium to trickle in. Then again what happens, the resting membrane potential, due to incoming influx of calcium and sodium, it again start going upward, right, and become slightly depolarized, right? But as soon as it reaches to peak, what will happen? Again potassium efflux will start and resting membrane potential will become again to its resting situation. But again cycle will be repeated. Is that right? Due to these repetition of these cycles, we can say the membrane potential inside the cell membrane of the smooth muscle fluctuate. It becomes slightly depolarized, then repolarized, then slightly depolarized, then repolarized, slightly depolarized, then repolarized. And this this pattern of fluctuation, that membranes slightly undergo depolarization, again repolarization, depolarization, again repolarization, these fluctuating potential changes in the membrane potential of smooth muscle are called slow waves. What are they called? These are, yes, slow waves. Remember, these slow waves are not action potential. These slow waves are not action potential, and these slow waves are inherent tendency of the gastrointestinal smooth muscles. Then again, these slow waves in the, what is this, smooth muscles of stomach. In the smooth muscles of stomach, these slow waves are produced 3 times per minute. 3 times per minute. And same slow waves are produced in jejunum and ileum about, yes, 9 times per minute, and same slow waves are produced in the duodenum about 12 times per minute. Let me repeat it. In the stomach, these slow waves, which are undulating membrane potential, right, with repeated depolarization, repolarization, depolarization, repolarization, depolarization, repolarization, these slow waves are produced, right, in the stomach smooth muscles about how many times? 3 times per minute. In the duodenal smooth muscle, 12 times per minute. 9 no, it is 12 times per minute in the duodenum, and in the jejunum and ileum it is 9 times per minute. Am I clear? Now, actually these slow waves are not action potential, right, and these slow waves do not produce contraction in the smooth muscle, right. They just set the basic frequency of electrical fluctuations. Now, what happens? The resting membrane potential is at -60 and threshold potential is -40, right. This is resting membrane potential, and what is here? This is threshold potential, and this is resting membrane potential, which is -60. So now usually, right, what happens? It means that when cations are coming in, right, resting membrane potential is approaching threshold, so smooth muscle is becoming more excitable, and then as potassium cations are going out, and from the after achieving the peak and potassium efflux start, then potential is becoming more negative and cell is becoming less excitable. So what really happens, we can say in another way that these slow waves, right, when they are produced, then gradually what happens, that excitability of the smooth muscle increases progressively and then decreases progressively. Now, if, listen now very carefully, if this peak of the slow wave touches the threshold, if peak of the slow wave touches the threshold, then voltage sensitive calcium sodium channels will open. These voltage sensitive calcium sodium channels are different than these cationic channels, right. These cationic channels were responsible to produce the depolarizing component of slow wave, and this potassium efflux was responsible to produce the repolarizing component of slow wave. But if peak of the slow wave, the top of the slow wave touches the threshold, then threshold voltage sensitive calcium sodium channels open, and they allow a lot of calcium to trickle in, and when a lot of calcium come in, then this will move upward. As soon as it reaches to the, what is this, membrane become fully depolarized, is that right? And as soon as it reaches to the top, what really happens? Again, lot of potassium goes out and it come back, but as soon as it come back, if still the slow wave is at threshold, it will again fire again. So what really happens, that if top of the slow wave is touching the, what is this, threshold potential, then at the top of the threshold potential, action potentials are produced as spikes. So these are also called spike potentials. What are they called? Yes, spike potentials. These spike potentials which are produced, these are actually the action potentials. Slow waves are not action potentials. But remember, slow waves play a very major role in production of spike potential. How? If slow waves, top of the slow wave does not touch the threshold potential, then what will happen? Spike potential will not be produced. If top of the slow wave touches threshold potential, spike potential, multiple spike potential can be produced. And if it is, let's suppose smooth muscle is really very excitable and it is going significantly above the, what is this, spike potential, then multiple spikes will be produced. Is that right? So what is the basic principle? Number one, spike potential, right, can only be produced at the top of the slow waves, right, which is the real action potential, can be only produced when slow waves, top of the slow wave reaches threshold. Now how many action potentials will be produced? It depends on that how large is the slow wave and how long slow wave remain at threshold. Is that right? Because if slow wave does not reach its threshold, no spike potentials or action potentials. Slow wave just touches and come down, few spike potential. But if slow wave is really strong and remain above the, at or above the threshold potential, multiple spike potentials are produced. Now, because heavy amount of calcium influx is produced during the spike potential, that calcium act with the calmodulin system and that produces eventually smooth muscle contraction. And if I show smooth muscle contraction by this color, now here there will be no smooth muscle contraction, right? But here with a slight delay there will be smooth muscle contraction. But in this case, because there are more spike potential, so intensity of contraction of smooth muscle will be stronger. So what I'm showing here I'm showing the slow waves. Here I'm showing the, what is this? Spike potential or action potential. Here I'm showing that whenever spike potential appear, then the really smooth muscle contract. This is the tension in the smooth muscle. So tension in the smooth muscle goes up. But tension produced in the smooth muscle is directly proportional to the heavy calcium influx during spike potentials, and that calcium influx is of course directly proportional to the frequency of the spike potentials. Here there are more spike potentials, right, and that produces larger or stronger smooth muscle contraction. Any question after this? There is no question, right? Now what we can say, that electrical activity in the smooth muscles mainly depends on, what is this? Slow waves. Now this also, the frequency of slow wave also determine the rhythmic contraction. There are two types of contractions in smooth muscles of gastrointestinal system. There is tonic contraction and phasic contraction. Tonic contraction means prolonged persistent contractions of smooth muscle, and phasic contraction is intermittent contractions or contraction followed by relaxation, again contraction followed by relaxation. Now these action potential, the spike potential, basically or primarily determine the what? Intermittent contractility. What is that? That is phasic, right? So phasic contraction depends on how many spike potentials are being produced at the top of slow waves, right? Now another thing which is very important to understand is that not only amplitude of the slow wave can be changed, not only frequency of the action potential can be changed. In these smooth muscles, you can also change the resting membrane potential. Is that right? Let me explain it. Already we have observed that if there is a slow wave is weak, there is no spike potential. If slow wave is stronger, there is a spike potential. And strength of the slow wave eventually determines the frequency of spike potential, and frequency of spike potential determine the intensity of smooth muscle contraction. Now we'll observe another thing, that this resting membrane potential, right, which is normally around -60, right, it can be persistently made more negative or it can be made less negative, right. There are some factors which move the resting membrane potential from -60 to -50 millivolt, and the other factors which can take the resting membrane potential from -60 to -70 millivolt. Now all those factors which take the resting membrane potential persistently near -50, they will excite the smooth muscle. Smooth muscle excitability will be increased, because then most of the slow waves will go above the threshold potential and smooth muscle will be more stimulated, right. But if some factor take the resting membrane potential persistently more negative, right, so they are taking the resting membrane potential away from the threshold, is that right, then excitability of smooth muscle will be reduced. How? Let's suppose if excitability of resting membrane potential is moved from -60 to 50, what will happen? Then slow waves, right, they will more frequently remain above the threshold, so more spike potential will be there. But if, let's suppose that resting membrane potential is away from the threshold and it becomes more negative, we say it is all the time hyperpolarized, right, then what will happen? Most of the slow waves will not reach to threshold. Threshold was here, right, and smooth muscle excitability is reduced. Now the question is that what are the factors which make the smooth muscles more excitable or take the resting membrane potential near to threshold, right? Number one is the stretch in the smooth muscle. If smooth muscles in the gastrointestinal system, they are stretched when GIT is distended. For example, there's big bolus of food here and this part of the GIT is stretched and smooth muscles are stretched. When smooth muscles are stretched, then these calcium channel like holes in an elastic membrane. When an elastic membrane has multiple holes and you stretch the elastic membranes, hole become wider. In the same way, when you stretch smooth muscle membrane, these channels become wider and more cations influx occur and stronger, and when the cation influx is more, right, what will happen? Resting membrane potential will remain persistently more near the threshold, plus stronger slow waves will be produced. Is that right? So what are the factors which can take it upward, right? Number one is, yes, muscle stretch. Number two is, yes, any condition will load the smooth muscle with the cations like acetylcholine, right? There are muscarinic M3 receptors on smooth muscles of gastrointestinal system, muscarinic 3 receptors, and either acetylcholine like drug is there or vagus nerve or parasympathetic, some other neurons present in gastrointestinal, you can say plexus, those neurons release acetylcholine. When acetylcholine stimulate the receptors, that lead to the calcium influx inside, and when calcium moves in, that takes resting membrane potential towards threshold. Is that right? So acetylcholine, and of course third thing is parasympathetic nervous system stimulation. So these are the factors which can stimulate and some hormones even. There are some hormones which stimulate the electrical activity in the smooth muscle, the GIT. Actually those hormones load the smooth muscles with the cations and take the resting membrane potential near the threshold. Is that right? So we can say resting membrane potential can be made less negatively polarized or slightly depolarized all the time, right, by stretching the smooth muscle or by acetylcholine or by stimulation of parasympathetic nervous system or by certain stimulatory hormones. Is that right? Then resting membrane potential, if it is taken away, it has been made more, negative, right? It means membrane is more hyperpolarized, right? Then smooth muscles become less excitable, right? Under what circumstances this can happen? This hyperpolarization of the membrane is seen when norepinephrine stimulate these smooth muscles, right? Because when norepinephrine stimulates these smooth muscles, right, that actually take the resting membrane potential away from threshold, and this become hyperpolarized, and natural excitability of the smooth muscle is reduced, right? Or of course by stimulation of sympathetic nervous system. Is that right? Do you have any question up to this? Or that, yeah, what is your question?
You're saying there's calcium leaky channels that keep on trickling calcium inside, and that maintains the frequency of the slow waves.
Yeah.
But I thought there were intracellular calcium stores also inside the cell.
Yeah.
The smooth endoplasmic reticulum.
Yeah. Actually the hormones, you are right. Actually the hormones can increase or decrease the excitability of smooth muscles by giving special signal to the calcium stores in the endoplasmic reticulum within the smooth muscle. If calcium is released from the endoplasmic reticulum, smooth muscle will become more excitable. If calcium is sequestered or stored in the endoplasmic reticulum, smooth muscles will become less excitable. Am I clear? Is there any question? No question, right? So let's have a break. Now we are going to talk about the nervous control of gastrointestinal system, right? First of all, I will discuss into detail the enteric nervous system, and then I will talk about that enteric nervous system activity is influenced by the autonomic nervous system as well. Now, what is enteric nervous system? Actually, it is also called the third division of autonomic nervous system. As you know, autonomic nervous system has one division called sympathetic part of the autonomic nervous system, then parasympathetic part of the autonomic nervous system. Then some authorities say the neurons which are present within the wall of gastrointestinal system, they should be considered the third part of the autonomic nervous system, or enteric nervous system. Enteric nervous system mainly consists of two neuronal plexus. One neuronal plexus is present in submucosa. Look, this is the mucosa, right? And this layer is submucosa. This is muscularis externa, circular layer, and longitudinal layer, and serosa. Now look, this is one layer of neurons which are present with their cell bodies and connections in the submucosa. This is called submucosal neuronal plexus. The other name for submucosal neuronal plexus is Meissner's plexus, right? Second neuronal plexus is present in muscularis externa, and second layer, or we also call it outer layer, is present in between the circular layer of smooth muscles and longitudinal layer of smooth muscles in muscularis externa. So these are the cell bodies and connections of outer plexus, which is also called myenteric plexus. Another name for this is Orback plexus. Orback plexus means this plexus is Orback plexus, or you can say outside plexus. This is an outer part, it is in the muscles. Now, what is the major function of submucosal? What is the major function of the submucosal plexus? Actually, submucosal plexus is mainly controlling the secretion of mucosal and submucosal glands, plus submucosal plexus also control the blood flow through the submucosa and lamina propria, and that also determines the absorption. So it regulates secretion, absorption, blood flow in this area, plus it's also, submucosal plexus also control and has influence on neuroendocrine cells which are present in this area, right? An important thing is that submucosal plexus usually control locally with local areas and small areas within the gastrointestinal system, right? But if we talk about the outer plexus, what is outer plexus? The other name for outer plexus is Enteric plexus. Another still name is Orback plexus, which is present between which two layers of muscularis externa, circular layer of muscle and longitudinal layer of muscle. Now this plexus of neurons is mainly concerned with the regulation of motility of gastrointestinal system. Now let me tell you exactly how it works. Enteric nervous system. Remember, enteric nervous system can work independent of outside neuronal control. if you disconnect all the sympathetic and parasympathetic fibers coming to gastrointestinal system, still these neuronal components of gastrointestinal system, that is submucosal plexus and enteric plexus, still can work independent of the autonomic fibers coming to the gastrointestinal system. That is why sometimes the gastrointestinal, you can say, these neuronal plexes are also called mini brain. Is that right? They can be influenced by autonomic supply, sympathetic and parasympathetic system, but they have their own intrinsic activity as well. Is that right? Now, how the enteric plexus work? Let me give you an example. We'll talk about how this nervous system works to create peristalsis. Let us suppose that, okay, you have eaten a chicken piece, right? Let's suppose there's a bolus here, amount of food here. Now this area will be stretched, right? Now this stretching of this area, right, how it will influence? These are the sensory neurons. I think these black neurons are the sensory neurons. So let me tell you. Now what really happens when food is stretching your gastrointestinal system? Is that right? In the lumen, if there is some stimulus, let us suppose stimulus is a large mass, it will stretch. When it will stretch, it will stimulate, what is this? A sensory neuron which is present in the muscle layer, and when this part of the gastrointestinal system is stretched, these muscles are also stretched, and these neurons are also stretched, and this neuron is stimulated, right? And this will stimulate, what is this plexus? Outer plexus or enteric plexus, right? So one way to stimulate the enteric plexus is by stretching a part of gastrointestinal system. Secondly, it can also be stimulated by giving some signal to the mucosa. Let's suppose there's chemical signal to the mucosa, or there's some irritation to the mucosa, right? Again, there are other sensory neurons. They will take this information and they will stimulate the, what is this neurons? Part of the enteric plexus. Now let's see that we say that when there's a bolus, this should produce peristalsis. The law of peristalsis is that to the oral side of the stimulus, gastrointestinal system should contract as a ring, and on the anal side or aboral side, the smooth muscles should relax. Now we have to see how this system works to produce a contraction just, yes, oral side of the stimulus, and how it produces receptive relaxation on the distal side of or anal side of the stimulus. Now we want that if peristalsis should produce, these muscles should contract and these muscles should relax, and this wave of contraction should pull the content of GIT towards the anal side. How exactly it happen? Now these sensory neurons from here as well as stretch neurons from here, they stimulate these fibers. Now I have shown, and look it carefully, that in enteric plexus I have shown two interconnected chains of neuron. These are the interconnected chains of neurons, right? And they are going to the oral side. We also call it ascending network. And these are the network of interconnected neurons which are mainly moving to the anal side or aboral side. These are also called descending network of neuron. So we can say in enteric plexus there is ascending, right, network of neurons, and there's descending network of neuron. And what we want? On ascending side we want contraction, and on descending side we want relaxation. It means on ascending side we want stimulation, and on descending side we want inhibition. How it really happens? When sensory neurons from mucosal side and from other areas, they stimulate the ascending neuronal network as well as descending, what will happen? First look at ascending. When ascending neurons are stimulated at this point, right, then what will happen? That these neurons will fire in this direction, right? And they will produce actually stimulatory neurotransmitters. These neurons produce acetylcholine and substance P. Acetylcholine and substance P, these are stimulatory neurotransmitter and they are produced by the ascending neurons. Now, when substance P is produced, what it will do? Substance P and acetylcholine, it will stimulate the neurons above the stimulus, or stimulate the neurons proximal to the stimulus, or stimulate the neurons in the ascending area, or stimulate the neurons which are on the oral side. When these neurons are stimulated, they will release their neurotransmitters on these circular, especially they will stimulate, what is this? Circular side. And circular smooth muscles will contract on this side. Right? So what will happen? The constriction will be developed right on the back of, what is this, chicken, right? So when this will contract, right? So at the same time, these sensory black neurons have also stimulated descending neurons. Now when the descending neuron, they are stimulated by mucosal stimulus as well as stretch stimulus. When they are stimulated, these descending neurons release neurotransmitters which are inhibitory. What are these neurotransmitters? These are inhibitory. These neurotransmitters which are released by these descending neurons, they are nitric oxide and they are, yes, what is it? VIP, vasoactive intestinal peptide. Vasoactive intestinal peptide, right? So both of them are inhibitory. So what happens that when this neuron is stimulated, it will start producing what kind of neurotransmitters mainly on which layer? Longitudinal, and some inhibitory neurotransmitter on the circular layer. So what happens, then circular smooth muscles will start getting relaxed, and when circular smooth muscle gets started relaxed, right, there will be receptive relaxation, right? And so just aboral to the stimulus, circular smooth muscle will relax, and on oral side of the stimulus, circular smooth muscle will contract. Is that right? And this piece of bolus will be pushed forward. Then what will happen? The new sensory neurons will stimulate the descending and ascending neurons, and ascending neurons will produce stimulatory effect at new, they produce at new site stimulatory effect, and descending neurons will produce inhibitory action on more distance to the anal side and receptive relaxation. And again, peristalsis will move, constriction ring will move forward. Is it clear or not? So this is one way how the enteric nervous system works. Again, let me repeat it. Enteric nervous system has a lot of neurons. The number of neurons is almost about 100 millions. You're a millionaire. As far as these neurons are concerned here in the enteric nervous system. These neurons are almost equal to the number of neurons present in spinal cord. So it means a very important nervous system. So you must understand. Enteric nervous system has two parts, submucosal part and what is this? Enteric part. Submucosal part is mainly concerned with secretions from mucosa. It is concerned with regulation of secretions, absorption, and blood flow in this area. Plus, submucosal neuron also control the muscles which are muscularis mucosae, a thin layer which produces infolding in the mucosa. But the real motility controlling neurons are enteric. And enteric neuronal plexus is having interconnected neurons which are ascending network and interconnected neurons which are descending. And ascending are stimulatory and produce acetylcholine and substance P. And descending are inhibitory and they produce nitric oxide and vasoactive intestinal peptide. Is that right? Now, what you need to remember is that whenever these enteric plexus is stimulated, ascending, when they get stimulated, they stimulate the circular layer just above the stimulus, on the oral side of the stimulus. And descending neuronal system, when it is stimulated, it inhibits the circular neurons just aboral to the stimulus. Am I clear? Any question up to this? Now, if someone asks you what are the difference, again, submucosal is concerned with secretion, absorption and and neuroendocrine secretions of these cells and blood flow in the mucosa and submucosal area. And what is this? My enteric is mainly concerned with the motility of gastrointestinal system like peristalsis and mixing movements. Then we come to that enteric nervous system is also influenced by the sympathetic and parasympathetic nervous system. Now, parasympathetic nervous system is supplying to the enteric nervous system of GIT through cranial vagal outflow mainly, and from the sacral outflow from S2, 3 and 4 through the pelvic nerves. From the vagus nerve, preganglionic fibers come up to the gastrointestinal system, and these preganglionic fibers directly innervate the neurons in enteric plexus as well as neurons in submucosal plexus. Is that right? And actually you can also think that these neurons, right, or cell bodies of neurons in enteric plexus and submucosal plexus can be considered post-ganglionic neurons of parasympathetic nervous system, right? But sympathetic nervous system, preganglionic fibers terminate in prevertebral ganglion like celiac ganglion or superior mesenteric ganglion or inferior mesenteric ganglion or hypogastric ganglion, right? So from there, post-ganglionic sympathetic fibers come and they influence the, what is this, enteric plexus and submucosal plexus. Now the very important role which you have to understand is what is the effect of parasympathetic stimulation and sympathetic stimulation on the gastrointestinal system. Let's discuss it conceptually. You know, sympathetic nervous system is stimulated when we are under stress. And do you think when we are under stress, we want our gastrointestinal system to work? No, because when you are under stress, fight or flight response, when you are going to fight, you don't want that movement to gastrointestinal peristalsis or secretions. You want to take blood, you want to reduce, when you are under stress and sympathetic nervous system is firing, you want to reduce the work in GIT. You can digest the chicken piece later, first you have to fight or flight. Is that right? So sympathetic nervous system is primarily inhibitor to the gastrointestinal system through the effect on the, what is this, enteric nervous system. Also sympathetic nervous system directly control the vasculature in gastrointestinal system. And parasympathetic system is considered rest and digest system. Actually, parasympathetic stimulation enhances the activity in gastrointestinal system. Parasympathetic system enhances all the activity of GIT. It increases peristalsis, it increases mixing movement. Parasympathetic nervous system also increases the glandular secretions in gastrointestinal system. Now look, if you have taken good amount of food and you don't have much stress, your parasympathetic system is working well, and parasympathetic, for example, vagal fibers, they can come and stimulate the enteric neurons, and that will lead to more peristalsis and mixing movement. And parasympathetic fibers will come to the submucosal area and stimulate more secretions, right? And they will also stimulate more absorption. So they help in digestion. Is that right? Because when peristalsis and mixing movement are more, right, then food is not only mixed with the secretions, but also it is propelled forward. And when, of course, secretions are more, digestion is more. And when food is moving forward, it is also absorbed better. Is that right? With mixing movement and peristalsis. So parasympathetic nervous system increases the peristalsis. It increases the, yes, parasympathetic nervous system increases the frequency of peristalsis, even intensity of peristalsis. Is that right? And also increases secretions and eventually absorption also. But when we talk about sympathetic nervous system, sympathetic neurons which secrete norepinephrine, they basically inhibit the orbic plexus as well as enteric plexus. Then of course you can understand when these two plexes are inhibited, when enteric plexus is inhibited, mixing movement and propulsive movement, peristalsis are inhibited. And when orbic plexus is inhibited, it's very understandable that will reduce the secretions in gastrointestinal system. Plus, sympathetic fibers directly also act on the blood vessels in gastrointestinal system and constrict the blood vessel. It's very important. Sympathetic neurons directly innervate the subclancnic blood vessels and blood vessels of gastrointestinal system and produce strong vasoconstriction, so that blood should be diverted to other organs where we need more blood during stressful situations like skeletal muscles, maybe you are planning to fight or flight. Is that right? Do you have any question up to this? That how what is enteric nervous system, can you answer and can you tell there are two divisions, right? Enteric and submucosal. You know submucosal work in local areas and concerned with secretion, absorption and local enfolding of muscularis mucosae and blood flow in the mucosa. And what is this? Enteric is mainly concerned with the motility, and sympathetic mainly inhibit the gastrointestinal activity and reduces blood flow to GIT. Parasympathetic increases the motility of the GIT as well as increases the secretory activity of gastrointestinal related glands. Is that right? Any question here? There's no question. Okay, that's good. Now I will talk about the certain reflexes which are related with gastrointestinal system, right? But again, don't forget, in the gastrointestinal system there are sensory neurons also. There are some short sensory neurons which have their cell bodies within the wall of GIT, and they just take the sensation from the mucosal side to the enteric plexus, and there are other local sensory neurons which take stretch sensation to the plexus, enteric plexus. But there are other sensory neurons which take sensation along with the vagus. You know, 75% of the fibers in vagus nerve are sensory. So these many sensory neurons from gastrointestinal system, they take sensation from mucosa and also stretch sensation and distension sensations, and they take all the way along with the vagus nerve sensation to the medulla. Is that right? And then there are also more sensory neurons which will take sensations from gastrointestinal system to the spinal cord. And something which usually students forget, that there are also sensory neurons from gastrointestinal system which take sensations up to the sympathetic ganglion. So how many types of sensory fibers are present in gastrointestinal system? Number one, sensory fiber for local reflexes, then sensory fibers up to the sympathetic ganglion mediated reflexes, then sensory fibers which are taking sensations up to the central nervous system, either through the vagus to the medulla or through other connections to the spinal cord for the reflexes which involve the central nervous system, right? Let me explain these reflexes very briefly. Now, there are basically three types of reflexes related with the neuronal reflexes related with the gastrointestinal system, right? And of course, like reflex, let me draw a diagram and explain it well. Let's suppose that here is your gastrointestinal system. This is a very simple diagram, right? Now listen. There are some reflexes, some neurons, sensory neurons which take information from one part of gastrointestinal system to another part of gastrointestinal system, right? So these are for the local reflexes. For example, if there's irritation here, more secretions will come. Or if there's distension here, peristalsis will start over here. These are intra-gut reflexes. What are these reflexes? These are intra-gut reflexes. These are for the secretions and mixing contractions and peristaltic contraction. Then, as I told you that central nervous system and sympathetic ganglion also play a role. Let's suppose this is preganglionic sympathetic fibers and this is postganglionic sympathetic fiber going to gastrointestinal system. Now, some sensory fibers can go from one part of gastrointestinal system up to the ganglia. Is that right? And then response come. For example, fibers from here, sensory fibers from the stomach can, when stomach become full, they can take sensations to a ganglion, and from that ganglion, fibers get connected to other part of gastrointestinal system, right? Now these are the reflexes which involve the ganglion, right? And these reflexes, right, these are called reflexes from the gut to the prevertebral sympathetic ganglion and back to the GIT, right? Classical example of this is gastrocolic reflex, that when you eat and your stomach is full, this reflex increases the motility in the colon. What is this called? Gastrocolic reflex. Then there is another reflex in which if small intestine or large intestine is overloaded, right, overloaded with the luminal content, it should inhibit stomach. And this reflex, right, sensory fibers go up to the ganglion and then motor fiber inhibit, what is this? Stomach. So this is called enterogastric reflex, right? So first was content of stomach lead to inhibition of stimulate colon. That was which reflex? Gastrocolic. Second reflex I told you, this was stimulatory. That when the contents of small intestine or large intestine are overloaded, luminal content, they will inhibit the stomach. So that is called enterogastric reflex. Gastric reflex, and that is inhibitory, reduce the secretions and reduce the motility of stomach. Then there is another reflex which is mediated through the ganglion, in which there is basically coloileal, that if colon is overloaded with the content, it will inhibit the ileum and stimulate the contraction of ileocecal valve, so that contents should not move very rapidly to the overloaded colon. And that is called which reflex? Yes, coloileal. Some people call it colonoileal. So these are three types of reflexes which involve the sympathetic ganglion. That sensory fibers go up to the sympathetic ganglion, and from there the motor fibers come back, right? Then the another type of reflexes are, I told you there are basically three types of reflexes. Intragut reflexes, secondly in reflexes involving the sympathetic ganglion, third type of reflexes in which sensory fibers go up to the central nervous system. For example, some sensory fibers from the stomach can go up to the, along with the vagus, up to the medulla, right? And then vagal response come back to the stomach, right? This is called vagal reflexes. Is that right? Which control the motility and the secretions in the stomach, right? Because sensory limb is also going through the vagus and motor limb is also coming through the vagal. So such reflexes in which sensory fibers go through the vagus to the medulla and then motor fibers come back through the vagus, what we call it? Vagal reflexes. Is that right? Then another classical example of reflex in which central nervous system is involved is when sensory fibers from colon and rectum, they go to the spinal cord, and then from spinal cord motor fibers come back and there is defecation reflex, that when colon and what is this part, last part of the colon and sigmoid, that is overloaded with the fecal matter, overstretched, and that can stimulate a defecation reflex and motor fibers are coming back through the spinal cord. Is that right? So how many types of reflexes? Intragut reflexes, which are local reflexes which produce secretions, right, and they regulate the secretion and absorption. Is that right? Then there are ganglionic reflexes like gastrocolic, enterocolic, and enterogastric and coloileal. And then there are reflexes involving the central nervous system like vagal reflexes or defecation reflex. Class dismissed.